talk at TCT 2015 in San Francisco, and I'm here with John Carroll from the University of Colorado. John and I have known each other for a long time, and we've been in the structural heart disease business for a long time. And much of this started with PFO closure. And now John has finally gotten some data which I think will be helpful, the RESPECT trial. So John, I'm going to let you tell the folks out there what the RESPECT trial is, and then we'll talk about the results.
Yes. So RESPECT is a multi-center, prospective, randomized, event-driven clinical trial to test the hypothesis that PFO closure is superior to guideline-directed medical management in preventing recurrent cryptogenic stroke in a relatively young patient group, 18 to 60 years of old, and has been going on for 12 years. And so it is very unique. It's the largest randomized trial in this area. It has the longest follow-up of any study in cryptogenic stroke, quite honestly. And it's been a lot of effort for a very important point of with 1 to 2% every year on medical therapy, people have recurrent strokes after their initial. Can we do better?
So this trial sort of may be a groundbreaking trial. We've argued about whether PFOs should be closed, and the FDA has argued about this forever. And now, what are the data?
Well, the data are, now that we've followed people for over 5 years and over 5,000 patient years of follow-up, we see now strong, compelling data that PFO closure is superior to optimal medical management in reducing recurrent ischemic stroke risk by a rate of 50 to 75%. And that was a key finding, and what helped clarify that finding is looking at the kinds of strokes that PFO closure can impact on. And as patients age, they enter, that age group where there are multiple factors that cause other kinds of strokes, and we had to deal with that. That was an important issue in this extended follow-up.
So the follow-up really tried to winnow out how strokes were produced, whether atherosclerotic, whether thrombogenic, whether God knows what. And you were able to do that. Tell me, John, I mean, we've come a long way with PFO, and now we have some data to actually support closure. For the clinicians out there and for the interventional cardiologists, do you think this is going to be the trial that tells the FDA, or not hope, but do you think the data are strong enough to really make a difference here?
I think so, but I also believe in the review process, the rigorous review process of FDA, and look forward to that, because I think now in this area we have long-term data that are essential to understand both the patient population, the disease, the medical treatment, and the impact of PFO closure. So now we have that data.
Okay, so one quick last question. Much of these data are driven by endpoints that occur over time, not within 1 year, right? So at 2 and 3 and 4 and 5 years is really where you see the effect.
Yes, you actually start seeing the effect in the first year, but it becomes steadily increasing over the first 3 to 5 years, and this then is sustained. And I think that's important because we need a durable treatment. Secondly, we need a treatment that's not going to have long-term side effects, and that was what was very reassuring. And there were 4 strokes in follow-up that were related to AFib, but guess what? 3 of the 4 occurred in the medical management arm, so they weren't device-related. We saw no thrombus in devices, so the safety impact is important to bring to these patients.
Well, PFO closure has been an interesting topic for a long time. I mean, seriously, now 20 years. And we're beginning to find long-term data which may make a real impact on whether or not we can just routinely go ahead and do this in young people after having their first stroke. Anyway, that's the way this trial was set up. And we'll see how things turn out with the FDA. Thank you, John.